Hi, my name is Michelle Henry. I'm with the University of Texas at Arlington School of Nursing, and today I will be lecturing about osteoporosis and the associated medications. Osteoporosis in postmenopausal women causes their bones to become weak and brittle, causing fractures of the hip, spine, and wrist. Approximately 1.5 million fractures a year are caused by osteoporosis, and this can lead to chronic pain and poor quality of life. After a woman reaches menopause, estrogen levels decline, which places her at a high risk for decreased bone mineral density and fragility. Usually there are no signs and symptoms of early stages of bone loss. However, as the disease progresses, she may feel back pain, a decrease in height, or a fracture that happens much more easily than expected. Treatment options are aimed at increasing bone density by medications, diet, exercise, and other lifestyle choices. To understand osteoporosis, let's talk about how this happens in the body. As we grow, our bones are constantly in a state of renewal, building up and breaking down. This normal physiology is called bone remodeling, where the body uses osteoclasts to break down bone through resorption and osteoblasts to build new bone through mineralization deposits. Osteoporosis occurs when this homeostasis is altered, and resorption happens faster than the building of new bone, leading to decreased bone density and fragility. After menopause, estrogen that's excreted by the ovaries declines, resulting in decreased bone matrix, calcium, and phosphate in the bones. The two medications I'd like to compare and contrast today are bisphosphonates. The first one is alendronate, which is Fosamax, and the second one is zoledronic acid, which is reclassed. These are both first line of defense medications for osteoporosis. Their mode of action is to inhibit osteoclast activity of resorption, thereby stopping the breaking down of bone and allowing osteoblasts more time to build bone. The expected outcomes are to stop the breaking down of bone and allowing bone remodeling to happen. Now, Fosamax is an oral medication. It's given daily or weekly, every morning with 6 to 8 ounces of water on an empty stomach. The patient must remain upright for 30 minutes to optimize the health benefits and decrease the GI side effects such as nausea, dyspepsia, or abdominal pain. The second medication, reclass, is IV. It's given yearly or after that every 2 years. The side effects are possible infusion reactions such as fever, flu-like symptoms, or local injection site reactions. Both of these medications are safe and approved by the FDA. However, there are two major side effects patients need to know about, and those are atypical femur fractures and osteonecrosis of the jaw. Both of these medications have been proven effective, and Fosamax, their efficacy has shown a rate of spine and hip fractures with significantly lower rates by 50% and the rate of non-spine fractures by 20%. Reclass showed spine fractures decreased by 70%, hip fractures by 41%, and non-spine fractures by 25%. Both of these medications do have interactions, and Fosamax should not be given with calcium antacids or iron because that interferes with absorption, as well as aspirin or NSAIDs because that will also lead to increased GI upset. Reclass should not be given with loop diuretics or aminoglycosides due to an increased risk of hypocalcemia. It should also not be given with any nephrotoxic drugs, such as NSAIDs or medications excreted by the kidney, because it has been associated with reduced kidney function. The cost of Fosamax is $130 a year, and reclass is $196 a year. So prevention, modification of environment and lifestyle includes strategies to prevent future fractures, such as resistant and weight-bearing exercises, consumption of vitamin D and calcium, and altering lifestyle choices. Women can deter fractures by decreasing their fall risk by incorporating exercises such as yoga or Tai Chi to increase and improve balance. They can complete a home hazard assessment and decrease their psychotropic medications and alcohol. Once a woman is diagnosed with osteoporosis, she can take these medications to increase her bone density and to reduce the risk of fractures. That concludes this lecture today. Thank you so much for watching.